Okay, so we'll go ahead with our third speaker for today. And next we have Dr. Susan Guzman. She is a licensed clinical psychologist specializing in diabetes, both as a researcher as well as a clinician. She developed and leads the multi-week depression series called Feeling Good Again, Breaking the Depression-Diabetes Connection. She is also project coordinator of BDI's Behavioral and Emotional Attitudes Toward Diabetes study, which investigates the impact of type 2 diabetes following diagnosis, and has previously been involved in studies examining family-based interventions in diabetes, as well as psychological insulin resistance. Her clinical interests include diabetes-related family issues, depression and diabetes, and the art of living well with diabetes. So please join me in welcoming Dr. Guzman.
Hello? Oh, okay. Well, thank you for that introduction, Sarah, and thank you to the Mary Greeley diabetes team for having me come from San Diego to speak to all of you today. I'm originally from Buffalo, but I've lived in San Diego for 25 years now, so this actually feels really cold to me. I'm such a baby. So I'm just a little bit of background about me. So I'm a diabetes psychologist, and when I say that, a lot of times, even people with diabetes sometimes will say, "What's that?" And I find that discouraging, because if I were to say I was a cancer psychologist, nobody scratches their head, right? Everyone sort of intuitively gets what that would be about. And so a lot of what I'm going to present to you today, you may not even have thought about of what makes diabetes hard. And so I'm going to talk about how do you go from discouraged to encouraged. So I come to you from a tiny little nonprofit organization called the Behavioral Diabetes Institute. And we say both sadly and proudly, we're the only nonprofit that addresses the emotional side of diabetes anywhere in the world. And we're a small little organization, so I get all of the emails that come in from around the world that are asking for help. What do you offer, here in Iowa? Or what do you offer in Florida? What do you offer in Italy? And I have to write back, I'm sorry, we don't offer anything. All of our clinical programs are based in San Diego. We do have a lot of resources online, and we're really working hard to get some grants so that we can put a lot more of what we do online so that we can be accessed anywhere. So what is diabetes burnout? And coming from the literature from burnout and other aspects of like work and things like that, diabetes management can feel like that full-time job that you didn't sign up for, you don't want, and you can't quit. And day in and day out, that job can take its toll. It can be unrewarding, discouraging, frustrating, and sometimes it can feel like the payoff isn't worth the work. And that's what can lead to this I quit attitude that we refer to as diabetes burnout. So what's so tough about diabetes? So if you can't tell what this is a picture of, it's a sidewalk leading up to a brick wall. And a lot of times this is what it feels like to have diabetes. And there's nothing that predicts diabetes burnout like discouraging results. Now, discouraging results could be that you feel like you did the same thing one day as you did the next day, except that day your blood sugars were high and you have no reason, you can't explain it. Or you started on a new medication and you actually gained weight. Or you've been working hard on this new diet and you've only succeeded in losing a half a pound. Or maybe you started on an insulin pump and now you're struggling with low blood sugars. There's so many ways that people can be greeted with their best efforts leading to discouraging results. So I'm going to be a psychologist nerd here for a second. I'm going to tell you a little bit about a psychology study that was done several decades ago, back in the 60s, by a famous psychologist, Martin Seligman. And he had studied the effects of discouraging results, but they used an animal model. So they had a dog. And so they had this metal cage that could elicit a mild electric shock on the bottom. And then they had a wall in the center that could be raised and lowered. And so they had the dog on this side of the cage, and the wall was halfway up, and they elicit the shock, and the dog jumps over, and they elicit the shock on the side, the dog jumps back. And then they raise the wall. They elicit the shock, the dog jumps, hits the wall, elicits the shock, the dog jumps and hits the wall. By say the third time that happens, what do you think the dog does when they elicit the shock? He doesn't jump. He doesn't jump because he's learned his efforts are going to be greeted with a brick wall, right? So why bother? So they lower the wall. Now the dog isn't blind. So they elicit the shock. Now what? What happens with the dog? He still doesn't jump, right? Because he's learned that his efforts are going to be greeted with a bump into the wall. Now you can teach that dog to jump again, but the instincts are when you're greeted with discouraging results, you stop trying. And that's, I think, that what happens a lot in people with diabetes. And these can happen in so many ways, in so many even subtle ways. For example, let's say that you worked really hard to bring your blood sugars down, and you took your A1C, say, from a 9.5% to an 8%. That's a lot of work. That's a big improvement. Is it still high? Yes, but it's a big improvement. So let's say you're excited about your good efforts, and you go into your doctor, and they say, you're greeted with the bad news of, you're still high, and if you don't start shaping up, so X, Y, and Z is going to happen to you. I can't tell you how many times I talk to patients around the country who have diabetes, and they're greeted with their best efforts are with a not good enough response. And again, I think that there's a lot of ways discouraging results can lead to that feeling of I quit. The other thing I hear so much about in the many stories that I hear from people with diabetes is that it's 24/7. You feel like you just never get a break from it. That, like a spoiled child that wakes you up in the middle of the night sometimes with, say, a low blood sugar or a trip to the bathroom, and you just never get a break from it. It follows you around when you go to Christmas parties and you'd like to, perhaps overindulge like everybody else. And that sense that you can't really get away from it. It's with you all of the time. And really, the pay stinks. So diabetes is a big job, and you have to work really hard to do what diabetes does, which is to make your blood sugars high. For some of you, your blood pressure high, and for some of you, your LDL cholesterol high. And you're working really hard just to bring it down to normal. So what's the benefit of all that? What happens when you work really hard and you got your numbers all in a safe place? What happens down the road? I can't hear you, but I'm going to guess you're saying, you stay healthy, right? But really what we're saying is you do all of that hard work and nothing bad happens. Work really hard and nothing happens. Now, as human behavior goes, that's not terribly rewarding, right? When we want that little bone when we've done our trick, and nothing bad happening down the road is a terrific outcome. But as human behavior goes, it's not a great reinforcer, right? We want something good to happen. We want our little treat after we've worked real hard. And there aren't a whole lot of treats when you're working really hard with your diabetes. In fact, again, a lot of what happens is discouraging results. And so that's another thing that breeds that I quit attitude. And really, I think one of the biggest things is there's so much to do. So one of my colleagues sat in a standard 4-week diabetes education class, and she counted the number of behaviors that were recommended that people change. And she quit counting at 155 things. 155 things. So if you're feeling overwhelmed with your diabetes, there's no wonder, right? And it looks like this. Eat more fruits and vegetables, limit sweets and saturated fats, eat 3 meals a day, eat at the same time each day, be more physically active. And there's lots of ways you may have to do that to, as you heard from the previous speaker, so even that's a one line there. It really could be 10 lines. Check your blood glucose, take your medications on time every day, have an eye exam, check your feet. I mean, it goes on and on and on, right? And that can feel overwhelming. And not all of these things are created equal. And not everybody, in fact, really nobody, is going to do all 155 things every day. We're all going to be picking and choosing what makes sense to us on any given day. So risk factors for burnout. No clear plan for moving forward. So after you've been handed that list of 155 things, and maybe you're told you need to work on your blood sugars or your A1C or perhaps your blood pressure, as I heard some of you mention. Okay, so you know that you need to bring those numbers down, but what do you do, right? What do you need to do exactly? So sometimes I hear so much from people that they just don't know where to start. It seems like such a big job. I don't even know where to begin. Sometimes people will start, but then they have a hard time keeping it up. I think it was W.C. Fields who said, quitting smoking was easy. I've done it 1,000 times. It's not so much the starting the change that can get in the way. Sometimes keeping it up. Keeping it up can be really hard. And sometimes it just doesn't seem either worth it or achievable. And something I hear a lot about that is actually kind of subtle, but it actually really can get in the way of how you feel about your diabetes, are problematic beliefs. And they're things like, I'm doomed anyway, so why bother? So if you feel like, and many of you have had family histories or parents, grandparents, maybe even spouses or siblings who've had a scary outcome from diabetes. And it may feel like that's how diabetes turns out in your family. And so, why would you bother making all those, hard changes if it's going to end up like that for you anyway? That really sense of feeling doomed is a big problem in diabetes. Sometimes people say, well, Susan, I kind of blew it. I've had diabetes for 20 or 30 years and it's too late for me. I hear a lot of times in our Getting on Track program, I just don't have the willpower. If my problem is I don't have the willpower. And I also hear nobody in my life understands how hard it is. Feeling isolated and alone with your diabetes is a really common problem. And sometimes I hear diabetes, sorry about the spelling error here, diabetes makes me feel like a failure. A lot of times when you have this idea of how you're supposed to manage your diabetes and you're falling short of that, that feels bad, right? That's embarrassing. And a lot of times your best intentions don't turn out into outcomes. You intended to go to the gym, but you just didn't get there. You planned on taking the medication your doctor prescribed for you, but you really had a hard time getting it in every day. So there's a lot of ways that this can make you feel like a failure. A particularly problematic one is when it's time to start insulin. Now, a lot of times in the past, insulin was used as a medicine of last resort, so to speak. So we didn't start insulin until somebody had way advanced diabetes. And so we used to say, all right, now if you don't lose that 50 pounds I've asked you to get off, or if you don't start exercising, if you don't start eating right, you're going to end up on insulin. It was used as a threat. And the underlying message in that was, one, insulin is something to be avoided at all costs. And the second thing is that insulin is somehow bad, or it means that you've failed. It's that failure message again. And who wants to say, okay, well, sign me up for that because I'm ready to admit that I failed. So, and actually that's really not true. We know that with type 2 diabetes, that it starts out as a disease of insulin resistance, and over time, the pancreas that makes insulin is just not going to make enough insulin for you. And the natural course of type 2 diabetes is over time, you are going to need insulin. That's not your failure. That's the natural course of the disease. All right, so this is a quiz that we give in every talk that we give at the Behavioral Diabetes Institute. So the American Diabetes Association, very well-intentioned, has spent and continues to spend millions of dollars trying to educate people about the dangers of diabetes. So tell me, diabetes is the leading cause of adult blindness, amputation, and kidney failure. True or false? Oh, we have some star students in here. Okay, the answer is false. Now you're going to probably throw tomatoes at me because it's a bit of a trick question, but to a large extent, it's poorly managed diabetes that's the leading cause of adult blindness and amputation and kidney failure. Now, why is that important to say? Because if you don't think that your efforts are going to have a payoff, why would you bother, right? And if you think that just having diabetes means you're doomed, it's not terribly encouraging. And so here's another way to say it. Well-managed diabetes is the leading cause of nothing. Okay, so here's another series of beliefs that can affect how motivated you feel to manage your diabetes. Okay, here's the question. You can tell how well you're doing with your diabetes by how well you're eating. True or false? How much medication you're taking. How you're feeling. Right, all are false. The best way to tell is by keeping a close eye on your clinical markers, your A1C, your blood pressure, and your cholesterol. Now, a lot of times, we know the right answer, but it's really interesting. Because I find I do this myself. My dad has type 2 diabetes, and I can turn into the diabetes police sometimes on holiday meals, And my dad, who struggles with his weight, I'll watch him eat sometimes, and he'll wash his pumpkin pie down with a regular Coke, and I'll think, oh, Dad, what are you doing? And actually, he pulls that off remarkably well because he's really good about exercising and getting on his and staying on his medication. He's actually has well-managed diabetes, but you can't tell by the way he looks or by the way he eats, and that's and so that's a bias. We cannot tell by looking at someone how well-managed their diabetes is. And certainly not by how you're feeling. Unfortunately, all of the things that make diabetes dangerous don't particularly hurt, right? Mildly elevated blood glucose, actually a lot of times people report they feel a little better when their blood sugars are a little bit high. That really stinks, right? If actually we had some alarms going off, that would help us take action. If diabetes hurt more before it had caused complications, it would help us be more on top of it. And tough feelings, and so being a psychologist, this is something I actually focus a lot on. And tough feelings really run the gamut in diabetes. Feelings of anger, frustration certainly, sadness, guilt are really common, and depression. Depression is something I could spend a whole hour talking about. Depression and diabetes are more likely than those who don't have a chronic illness, and so if you have either type 1 or type 2 diabetes, your risk of running into a problem with depression or what's called major depression or a clinical depression are about 2.5-fold times likely than if you had no chronic illness. And what's particularly problematic with people who have diabetes is that we see a lot higher risk in running into problems with complications. A1Cs tend to be 2 and 3 percentage points higher if you have depression. And I think a lot of this has to do with when you have depression. One of my patients described it as, he said, Susan, when I have depression, it's like my give-a-damn is broken. And he says, like that country music song. And he says, when my give-a-damn is broken, it's really hard to care about what my A1C is, how many times I checked my blood sugar that day, or really, if paying attention at all to how I eat. And it really shows up in one's self-care. So depression and diabetes are a really dangerous combination. And so I tell you that if you struggle with it, one, you're not alone. It's a very common problem, and it's really important to get treatment. Some of the cardinal symptoms are a loss of interest or pleasure in things that you used to enjoy. That loss of interest is kind of like that give-a-damn is broken. And feeling down, irritable, sad, or even empty. A lot of times men and older adults will report feeling irritable or empty more than they will sadness. And then there's a whole host of other symptoms like difficulty concentrating, feelings of hopelessness, struggling with energy, like your get up and go is got up and went. And it's not explained by high blood sugars or some other medical conditions. You just have really struggling with energy or feeling slowed down. Thoughts of suicide, difficulty sleeping. So I thought I'd talk to you about a patient that I worked with, and because I thought she really represents a lot of what I just presented to you. Her name is Susan. She's 59 years old, and she was diagnosed with type 2 diabetes 11 years ago. When I first started working with her, A1C was a 9.2, and she was on oral medication. She was not testing more than once a day, and really that was being generous, that she checked it all, actually. She said she felt unmotivated, and that's really why she came to see me. She says, I'm just unmotivated. Everything she had tried didn't seem to be helping, and she says, I just feel like giving up. That's diabetes burnout. And I want you to know that the bottom line that I'm going to talk to you about is that no one's unmotivated to live a long and healthy life. The problem is obstacles arise, right? Things get in the way. Life gets in the way. And sometimes, like straws on the camel's back, even removing one straw can shift everything. You can manage your diabetes, so let's talk about strategies for moving forward. So the first question I asked you, are you well managed? So a lot of times I have people come into my programs and they'll say to me, my diabetes is really out of control. I'm a bad diabetic. And my first question to you is, based on what? So how do you know that? Are you saying that because you're overweight or how you're eating? A lot of times, again, we fall into those myths. Well, I'm eating like crap, so I must have poorly managed diabetes. And that may not be the case. The only way to know if you're well managed is to know your ABCs. What is your A1C? Now, the standard goal for A1C set by the ADA is 7%. Now, if you're a significantly older adult in your 80s, a lot of times they'll set the A1C goal a little higher. And that's because they really don't want you to struggle with low blood sugars and falling, because you're at greater risk for falls. So these are, standard numbers, but a lot of times these will be fine-tuned by your doctor to your personal needs. Blood pressure, 120 over 80. I know that may feel unattainable for some of you. And LDL cholesterol under 100. The way you can remember that the LDL cholesterol is L stands for lousy, so L under 100. It doesn't really stand for lousy, that's just how I remember it. So those are the ABCs, and really that's the only way to know if you have well-managed diabetes. That's the only way to know. We can't tell just by looking at you. And the second thing is what's getting in your way. And sometimes this requires a real honest evaluation when you think about what's tripping me up. So identifying your barriers and problem solving is really key to moving forward. So I'll talk you through what we did with Susan. So after I talked to Susan about that feeling that she had about feeling hopeless and giving up, I did a depression screener on her, and she acknowledged that she had depression, and she had been struggling with it for about 3 or 4 years. And she told me that her doctor wanted her to start insulin and had really been after her to start on insulin for the last year, but she was fearful. And she says, and it's really proof that I failed. And she said she felt like her husband was going to be really mad at her for having failed at her efforts to change her lifestyle. And she says, once I start on insulin, he's going to know I failed. And she had very little support. She was in a very difficult marriage at the time, and really felt very alone with her diabetes. So what's your plan for action? So making some small, very specific action for change is really important. I'm going to tell you a story about my best friend in graduate school, so you'll understand what I mean by the 15-second equivalent. So my best friend in graduate school, his name is Scott, so about 12 years ago or so, when we were finishing up, he was about 150 pounds overweight, and he had really struggled with sleep apnea, and so he was taking some of the same classes that I was, not because he was interested, but because he was having a hard time staying awake, and I would poke him. And so the first thing he did was actually he got treatment for sleep apnea, and Scott had pre-diabetes, so he had all of the warning signs. His fasting glucose was climbing up. He had sleep apnea, high blood pressure, high LDL cholesterol, and so he got treatment for sleep apnea, and he didn't need to take classes with me anymore after that, and he finished his doctorate, and he went off to do his postdoc at the Mayo Clinic in Minnesota, and he calls me up on the phone one time, and he says, "Guess what? I'm going to be running a marathon." And I laughed out loud. I didn't exercise at the time either, and I thought, you're not going to run a marathon. You're any more than I would. And he says, you watch. I'm going to run that marathon. I thought, well, good luck. Go for it. And So I didn't talk to him for a couple months, and he calls me up and he said, oh, by the way, I booked my tickets to Honolulu. I'm going to be doing the AIDS marathon there in December, whenever it was. And I said, my gosh, Scott, you're really doing this? And he said, yeah, I've been training. I said, wow, well, how did you start? And he says, I started with 15 seconds. 15 seconds. He goes, I didn't stop there. That's all I could run for was 15 seconds. So I time myself. So I do 15 seconds, and then I'd walk, and then I'd do 15 seconds again. And he said it was amazing that those 15 seconds, over a couple of weeks turned into minutes. And, now at 2 months in, whatever it was, he says, I'm now up to 4 miles. And Scott ran that marathon. He was a big guy running a marathon. He had lost about 50 pounds training for that marathon. And he was 100 pounds overweight, and he actually ran that marathon. He didn't walk it, he ran it. And he needed gastric bypass to get that last 100 pounds off. And he's now normal weight. He doesn't have the symptoms of prediabetes. He's a mountain climber, a scuba diver, and a marathon coach. He actually coaches hundreds of people now who have a variety of chronic illnesses to start running marathons, to go from the couch to a marathon. And I don't relate to the marathon runner per se. I actually don't relate to him very much anymore when it comes to exercise. But I can identify with what it would be like to start with 15 seconds. And he moved me so much that when I started exercise, I could do 5 minutes on my elliptical. That's where I started. And so you start with where you're at. And if it's 15 seconds, so be it. That's where you start. And if it's not exercise we're talking about, what's the equivalent? So, if you think about all the changes that you need to make to your lifestyle, start with where you're at. Pick one meal, perhaps you want a meal plan. You don't have to do all of them. Start with breakfast or dinner. Or if you're talking about taking your medication, make sure that you're getting your nighttime insulin on board, for example. And you get it on board every day. And so whatever your behavior change you're working on is, pick one and start small and let it count. Because marathons can happen when you start with 15 seconds. And I see that all the time. I see people make huge transformations in their lives, but they start with something small and they build on it. So with Susan, before I should say that, I should say pick the biggest bang for your buck. So on that list of 155 things, that goes with good diabetes self-care, and not all of them are created equally in how they're going to affect your A1C, your blood pressure, and your LDL cholesterol. For example, drinking more water is on that list. Now, if you're not taking your medication and your A1C is at 10%, drinking more water is not going to help. So what would be the biggest bang for your buck? Are you on the right medication, and are you taking them, right? Exercise will have big payoff in all 3 of those numbers: A1C, blood pressure, LDL, cholesterol. And it's actually the cheapest antidepressant exercise. So, for example, with Susan, she agreed to talk with her doctor about starting on an antidepressant, and she later started psychotherapy with me. She agreed to try insulin, and we really talked about the problematic beliefs that go with that. So we really worked on how she was fighting insulin because it made her feel like a failure. And so she agreed that, I talk about picking the right battle, right? Are you going to fight the idea of insulin, or are you going to fight the high blood sugars? Because you really have to pick, right? And you're going to get a whole lot more payoff if you put your fight in the right direction. And I think it's really important, again, with that big job that is diabetes self-care, that you take pause to notice what you're doing right. So if I had everyone do a diabetes scorecard in here, you would all have areas of strength. And when you feel like diabetes is that big job with no pay, it's really important that you take pause to notice what you're doing right. All of you, you're all here on a Saturday when there's a big college football game going on. So you're doing something, right? So you're taking time to learn about your diabetes. That's important. So notice what you're doing well. So for Susan, she was actually walking 5 times a week for 2 miles. That's remarkable. Again, her A1C was high because it was time for her to be on insulin. And she was actually exercising a lot. And she was taking all of her oral medication as prescribed. That's a big deal. She recognized that she needed help. Getting help when you need it is a strength. And here's a really great idea if you're having that diabetes burnout is, do you need a vacation? Now, when I talk about diabetes vacations when in a room that has physicians in it, they usually want to throw me out of the room because they think what I'm saying is go off your medication. And that's not what I'm saying. So everyone needs a break, and consider a diabetes vacation. So just like any good vacation, there's some key elements to them. One is they're safe. They're planned. They're time limited, so it's not a diabetes sabbatical. It's a diabetes vacation. And it's restorative. So it might be you really work hard on your meal planning, but you give yourself Friday evenings off, that you're going to go out to dinner with your family, and you're going to have pizza, and you'll take whatever medication you need, and you're going to just enjoy it. And safe, planned, time-limited, and restorative. So sometimes I'm working with people who are struggling to sort of do everything right, and when I ask them to take a night off, they beat themselves up over it. I went ahead and did that, Susan, and my blood sugar went way up, and I felt so guilty afterwards, and I beat myself up, and well, that's not very restorative, is it? So if you're going to do it, I want you to embrace it, enjoy it, say this is my diabetes vacation, and really use it as a reward for all the hard work that you do day in and day out. What we used to call cheating, we've tried to turn that into something that's actually helpful, because diabetes is more than a marathon, right? It's something you have to do every day for the rest of your life, and you do need to take breaks. There's just some key ways that you can make those breaks safe and actually helpful. So Susan allowed for the occasional splurge on her favorite food, was a hot fudge sundae, and she used to lament over not eating them anymore. I never get to have my hot fudge sundae anymore. And I said, well, let's figure out a way to do that and make it safe, that you do it, you don't have to feel bad like you're cheating or that you've given up your favorite thing. So what she would do is watch her carb intake for the day that she was going to have one, and she made sure to get in her exercise. And again, it has to be restorative. Don't beat yourself up later if you have a high blood sugar. That's what happens when you have a hot fudge sundae. One high blood sugar is not going to be the doom of you. So it was important that when she did have her diabetes vacation, that she enjoyed it. We know that doing diabetes alone, we call it a team sport, right? Doing diabetes alone is really hard, and it requires not only a good healthcare team, a nutritionist, a diabetes educator, a nurse or doctor, but it's also really important that you have someone who's cheering for you. I really encourage you to get support. If you don't have it, and I don't know if they have diabetes support groups here. Unfortunately, sort of a trend around the country is that they've been being cut because diabetes support groups are not a reimbursable service. And so in the effort to be more efficient with the dollars, a lot of these kinds of support programs have gone away. So check and see if you have local support groups. If you're an online person, there's a really terrific diabetes forum called 2diabetes.com, and they have sections for caregivers, for type 1, for type 2, for parents. It's really a terrific resource. And ask your friends and families to join you in your efforts. So one of the things that I brought for you all today, and if you didn't get one, they're in the back, it's called a diabetes etiquette card for people who don't have diabetes. And what this is the rule book for people who don't have diabetes. And so, if somebody says, should you be eating that? Or let me tell you a horror story about my grandmother who lost her legs to diabetes. You can go, you must not have gotten the rules. You just broke number one. And it's actually sort of a non-threatening way to start a conversation with somebody who's driving you crazy. And it's not just the don'ts, it also has do's in there, like do offer to join me in making a change. Rather than telling me what not to do, how about exercising with me? Do ask what I need rather than telling me what to do. So I brought these for you because a lot of these are, it's really a sort of, a non-threatening way to start a conversation if there's somebody in your life that you'd like to support you more, but what they're currently doing isn't helpful. So that's the diabetes police. So feeling stuck. So if you're feeling stuck, please get help if you need it. For Susan, she worked hard on depression and got it into remission. The goal for depression is not a little bit better. Sometimes people will say to me, well, I started on antidepressant a few years ago and I am a little bit better. That's not the goal. The goal is remission, okay? She's done real well on insulin. She's actually, when she got started on it, and when she was over that sort of psychological idea of feeling like she failed, she actually did really remarkably well on insulin, and her blood sugars went way down. Her A1C is now below 7%. She's become very involved in the diabetes community, which has really helped her not feel alone with her diabetes care. I know my colleague, Dr. Bill Polanski, has been here before and has given talks on to this group, but Bill Polanski wrote this terrific book, which he often doesn't brag about, but I think is actually just a tremendous resource, and it has really sections in it applied to type 1 and type 2 diabetes. It's called Diabetes Burnout, What to Do When You Can't Take It Anymore, and it's available cheapest actually on Amazon.com, but you can also get it through the American Diabetes Association on their website, diabetes.org. And my last message to you is to really have hope. And I have found that hope, and hope can mean different things to different people. So, one of my patients that I work with, I do a Living Well with Complications class. And so these are people who, perhaps have had, like one of my attendees had a heart transplant, another one had an amputation, another one had a kidney transplant. And hope to them may mean that it's not that they're necessarily going to avoid complications, but hope could mean they're going to have further complications. So it's the message of hope that applies to you, and it's real. It's evidence-based hope. What action can you take that's actually going to have real payoff? One of the reasons I love working with people with diabetes is that if I can help you make a change, I can not just improve your numbers, but I can help change someone's course of their life, and it's very rewarding. And I think for those of us who love working with people who have diabetes, really that's the mission, that's the passion. There is a lot of hope in diabetes. We now have the tools and the knowledge to really help people achieve good care. Unfortunately, we still as a community have a lot to do to improve. One of the last major epidemiological studies that looked at massive numbers of people with diabetes to see who's meeting those goals of A1C, blood pressure, and cholesterol. How are we doing? And unfortunately, when we look at all three numbers, only about 13.2% have well-managed diabetes. And so even though we have the knowledge and the tools to help you achieve it, we know that behavior change is really hard. And so we need to be doing more to help all of you get there. But there is hope. It's never too late to start. Even if you have complications, it's never too late to start. And one of the things that I learned along the way is small changes can really add up to big results over time. So really champion your small changes and let them matter. So I'd be interested in leaving you with this challenge. You had a lecture this morning on foot care, and maybe you learned something that you'd like to integrate into your self-care. You had a great lecture on exercise, and again, sort of very similar in messaging that, just start somewhere. Give yourself permission to start small and build on it. To think about, what are you going to try? What are you going to try? If you're interested in learning more about the emotional side of diabetes, this is our website, behavioraldiabetes.org. It's in microscopic print on the little diabetes etiquette card on the last page, but we have free, everything on our website's free, and you can download videos, and we have a PDF version of this that you can email to somebody, or we have an online just for parents program for teenagers with type 1 diabetes, and we're trying to build more of our online programming. So if you're interested in signing up for our newsletter, you would be informed of those programs once they become available. If you have any questions that you would like to directly ask me and you don't get a chance to talk to me today, you can always email me at info@behavioraldiabetes.org. That goes to me. And I'd be interested in hearing your stories or your comments or your questions.
I'd just like to say that we do have a support group here for
Right.
adults with diabetes, and it meets the first Tuesday of every month. We start in October and we go through June, and it's from 7 to 8 p.m. upstairs in the Diabetes Education Center in the classrooms up there. Sometimes we have speakers, sometimes we just get together and talk about things and, offer support that way. But we do have a group that's going, so
Great.
come join us.
And I really encourage you to take advantage of that, in particular if you're feeling like you have no one that's cheering for you. All right, I have like about 15 minutes for questions, so I'd be happy to hear from you all.
I was diagnosed with diabetic 1 25 years ago, and two things that my wonderful doctor said. Too bad, Americans eat too much. And every single holiday is loaded with food. There's not a single holiday that you could get by in a year without eating wrong. And the other thing I say to people, how is your diabetes going? And I say, it's going well, but I need 36 hours a day. And they look at me. I need 36 hours a day to control it.
Yeah.
But people don't understand.
No, they don't.
And so a lot of my friends that I used to go out to lunch or supper or whatever, lunches aren't good for me to go out anymore and have lunch with someone. But you have to learn. I have a diabetic 3 here, my husband, who's been so supportive. And you need support.
Absolutely. Thank you
It's
for
not
that.
easy.
It isn't easy, no. Yeah, there are, really, that's true. They say if you really counted those 155 things, if you were doing them all every day, not that you can do them all in a row, but if you did them all in a row, it would take 3 hours. Any other comments or questions?
Yeah, one of the main problems that we've had with the type 2 diabetes is we're also on prednisone.
Oh. Yeah.
So that it's very, very difficult to control
Yeah,
it.
so that will send your blood sugars absolutely crazy. So if you're on a steroid, that can really make your blood sugar go nuts. And so really that's another one of the problems, right? Is it's not like you just have diabetes. When you're as you advance in age, you also have, arthritis and, perhaps, lung problems or whatever. You're managing multiple chronic illnesses, and some of them compete with each other, don't they? So it would be, what would be really important for you to remember is that your goals are going to be different, because it's nearly impossible to have at target numbers when you're, after you've just had some prednisone. So I think that, for your doctor to keep in mind, your goals are not going to be the same as somebody else's, because your situation is different. And that's what, again, individual goals are really important, that we can give you targets, but, if you have something that complicates your diabetes, your goals are just going to look different. And what well-managed means to you will mean something different. Thank you for that. That certainly makes it hard.
Thank you.
That's the end of your day. Everybody's needing lunch.
Any last questions for Dr. Guzman? Okay, here. I'll Janet.
One thing we found to be helpful is the major restaurant chains. If you go online, you can get full nutrient information, because menus don't have it. You get your sodium count, carbohydrate count, fats count, everything's on there. So a little bit of work with internet, you can find out what you can go into a restaurant and actually safely eat.
Yeah, that's terrific. That's actually pretty scary once you look at that, isn't it? Kind of ruins the fun. It makes carb counting a whole lot easier, but then you really may reconsider.
All right. I don't see any other hands, so thank you very much
You're
for your
welcome.
time. And again, these will be on the table as you leave, and if you can go ahead and drop off your evaluation. Thank you very much for spending your morning with us.